The retreat is being facilitated by the Hospital Statutorization Transition Team STT, which began operations in April 2025. Its goal is to establish a clear and actionable plan to transition Grenada's major public health institutions, including the General Hospital, Princess Alice Hospital, Princess Royal Hospital, Mungay Psychiatric Hospital, and the Hospital Laundry, into a statutory framework. This planning retreat marks a major milestone in Phase 1 of the team's operation. Lucia Livingston-Andal is the chairperson of the Hospital Statutorization Transition Team.
We have been given 1 year to put this in place. We were appointed as of April 1st, and we have 1 year from that date to ensure that at the end of the day, at the end of that period, we have the framework for a successful transition into a statutory body. What does that mean? It means that we have been engaged and we have been tasked to look at all of the necessary things that has to be done to ensure success. Now, a statutory body would provide the flexibility and the autonomy for quicker decision making and more effectiveness and more efficiency. It means that we have to transition all of the systems, the processes, the operations, our HR, all of the other ancillary things that would ensure that an organization can run effectively must be analyzed, must be reviewed, and must be transferred effectively and efficiently.
Livingston-Andal underscored the importance of these engagements.
No, today's session is very important. Today's session is a bringing together of all of the players. So we, as a transition team, we have a responsibility to guide the process, to facilitate the process. However, we are not the actors. We are not the main actors. We don't want to leave anything out. We want to hear from all the players. What are your issues as you manage on a day-to-day basis? What are the things that are preventing you from being as effective and efficient as possible? We document, we list, and then together we develop that plan. We have been appointed by cabinet, and as such our responsibility is to the cabinet. So yes, so having drafted the plan, again, of course it is going to be there going to be discussion back and forth. We'll ensure that there's inclusiveness in everything that we do, and once we're comfortable, then it's going to be presented to cabinet.
This statutorization process is expected to enhance hospital governance, operational efficiency, and service delivery across the nation's healthcare system. Dr. Brendan Lagrenade is a member of the STT. Dr. Lagrenade said discussions like these are critical to keep all stakeholders abreast of what every step towards statutorization entails.
That this is ground zero, this is day one when we begin the discussion, because health is very important to the sustainability of our society. And this transition into a statutory body, we're looking at being able to provide Grenada some 51 to 52 years after independence with the level of quality health care that Grenada deserves. So we take this opportunity very seriously, hence the engagement at the first step in order to quell fears and to make the right decisions based on overall input and not be something that we develop and hand down. And it is specifically based on, one, communicating information out, and then receiving feedback. So we have, from looking at our current state, presentations from the current leadership, including the Chief Medical Officer, Chief Nursing Officer, Medical Director, and others. And then we look forward to what the future looks like within healthcare with Project Polaris, which has been in the media a lot, and the state-of-the-art hospital that is on the horizon, putting a little bit of information, or putting information out so that people get a better idea, especially key stakeholders.
Christina John, GBN News.